This with everyone, and we are recording now, so we are going to get started. Welcome everyone. I know we have at least 100 restorers on the line right now for a topic which is proving to be very, very critical and important for our industry. If Marc Springer in Bozeman, Montana is getting phone calls for folks that are concerned about COVID-19 or coronavirus, just for the sake of clarity today, when we're talking about coronavirus, we likely will just be using the acronym COVID-19, just so no one's confused. But if I'm getting calls in Bozeman, Montana, I know that folks in Chicago, New York, Dallas, and large metro areas are certainly being inundated right now. And so thus the reason RIA has felt, because of the important nature of this topic, public health risk that we face right now, and particularly sending our team members into these environments, it's very important to provide information to restorers, and this very well may be the first of additional briefings as we get more information that we make available to the industry at large. As we get going, just a couple of quick introductions. My name is Marc Springer. As I already alluded to, I operate a restoration company that has 6 locations and about 135 souls across the state of Montana. I'm also the RIA president-elect, and it is my honor and my privilege to serve the restoration industry in that capacity. With me, Katie, go ahead and wave. Of course, you're the only girl on the call with a video right now, but Katie Smith is been so kind as to make arrangements through her connections with the Mid-South Professional Cleaners Association to broadcast live from there. So I know we have at least, I think 70, is that about right, Katie, people who are live in that room. Thank you to the Mid-South Professional Cleaners Association for providing the venue for us to be able to seek you and come to you live from. Katie is a member of RIA's board of directors and also the secretary for the executive committee. Katie is a tireless volunteer for the restoration industry, and we are so grateful for her volunteer work on behalf of the industry. Katie, anything that I missed or that you want to add? You guys may have, I'm going to unmute you guys now. I think you muted.
You guys are muted.
They're muted. We will take the lip reading for right now. Katie, thanks for what you do for everyone.
Thanks for letting us assist.
Oh, there they are. Thank you. Next, we have Norris Earhart. Norris will be sharing a lot of the information that we have. I'm just so pleased that Norris, on very short notice, was willing to step in today. Norris is a veteran restorer with over 35 years of experience, working not only for some very large restoration companies, he also operated his own company back many years ago when a lot of the practices that we take for granted now were in their infancy. Norris has a distinguished position in our industry, being one of the instructors for the Certified Restorer Program, which has a legacy that goes back many decades within RIA. In addition to that, he was also an insurance adjuster. He was the chief operating officer for TOMI, and this experience that he had plays really a great deal of value into the opinions that he will be offering today. He was part of the team that brought DARPA, which is Defense, I have to look here at this, Defense Advanced Research Agency technology that was designed to fight weaponized anthrax to the market for customization and use for the Ebola outbreak, which happened in Africa, and also the MERS coronavirus, which was very deadly in Saudi Arabia. Norris works very closely with infection control professionals and has probably, many people on this call, worked with your teams to certify them for ICRA and work in healthcare. So almost needs no introduction. Norris, thank you again for being here on short notice. We also have James Jenkins, who is one of the founders of SICTI, which is the Construction Infection Control Training Institute, has worked with Norris over the years. He's a certified industrial hygienist and is on the board of directors of many industry groups, including the American Board of Industrial Hygiene, the NFPA, and the American Society for Healthcare Engineering. So there's some very, very established and respected professionals here. One of the reasons that I immediately identified Norris as a person to speak to this is because we want to really delve today into how this issue impacts restorers. And as a restorer, as an operator, Norris brings not only the scientific perspective, but also the perspectives of someone who is dealing with many of the issues that each of you face every single day of trying to make decisions and determinations as to how am I going to deal with this issue that I face right now. And then last but not least, we have the restoration lawyer, Mr. Ed Cross, joining us today, who is at the Mid-South meeting as well and presented already earlier today. Ed is, I think, needs no introduction as the restoration lawyer. Of course, he's the principal of Edward Cross and Associates, which has worked with restoration contractors in their legal challenges over a very long and distinguished career of over 25 years. Currently, he's serving as a restoration advocate, in addition to his very busy law practice, which has been advancing the efforts of the AGA effort within RIA, which has been gaining tremendous steam and traction as of late. We will be having Ed speak to a few of the issues that contractors should be thinking about as it relates to their contracts and their liability near the end of this call. Ed, thanks for being here as well, and thanks for all you do.
Thank you, and thank you for organizing this on short notice and for your incredible leadership for the industry, Mark. You are truly a luminary.
Okay, you don't get to say anything more that will make me have to stop the discussion. Folks, we're going to jump right into this because our time is limited. We have slated about 40 minutes here. I want to be very respectful of everyone's time. And I will say this, if people have to jump off, again, this is being recorded. We will make this available to everyone. But we do realize that because of the gravity and the serious nature of what we're dealing with now, this could go a little long. So we'll endeavor to be as concise and as brief as we can. I will endeavor to keep our discussion on the rails as much as possible. Certainly, we could have many days of instruction and discussion about this issue, so we certainly understand that. But I'm going to start with Norris. Norris, the first thing that I want to talk, this is going to be very much in a discussion format today, and then JJ, you feel free to jump in at any point. But I want you to speak, Norris, because I'm sure that you have some sources and some folks that you deal with and that you are talking to who can help us cut through some of the challenges we face right now, which particularly relate to evaluating this threat. I mean, it's all over the map. We hear a lot of people saying COVID-19 is hugely overblown. This is no big deal. It's no worse than influenza. I think as I even personally have evaluated this, we're trying to make sense of this. So from your perspective, as you speak to your speak to the restorers here on this call, how are you evaluating this, and what are your expectations for this in the short term and the long term? When I say short term, I mean maybe the next couple weeks, and then the long term out over the next couple months.
Yeah, it's really interesting because a week ago was sort of downplaying this and focusing on the numbers of the influenza season that we've had this year and comparing it to it and blaming a lot of what we're seeing from a worldwide reaction as media hype. As this continues to develop and as we continue to learn more and more about this virus and the potential impact in sheer numbers, then it has taken a very different path for me. And I believe that we need to look at it very seriously. Now, I'm not going to stand here and talk to you as a virologist or an epidemiologist or anything like that, because that's not who I am. I am going to talk to you from my perspective about what we need to do as restorers who are already getting these calls somewhat out of hysteria to come disinfect my entire facility, the entire mall, all of the college or whatever, and just some things that you really need to consider before we jump into this. To go back to your original question a little bit, I believe in the next few weeks we're going to to see significant increase in numbers as we begin to identify this and as we begin to continue to test it and get test kits out there. And we're going to see significant, not only public concern, but strain on all of our infrastructure, supply chains, and panic to a certain degree that we haven't experienced, at least in my lifetime.
Wow, that's very significant. So JJ, what would you like to add to that? I'm sure you guys, both of you, both JJ and Norris, are getting an incredible amount of calls. You guys have trained so many people in the industry that I would think in many cases you're one of the first calls they're making. JJ, how are you evaluating this risk? And tell us about some of the calls that you're getting and how you're responding to some of these calls.
Sure. Thank you, Mark. I agree wholeheartedly with Norris in that in the near term, I suspect a significant, if not gigantic, leap in actual numbers of cases due to, if nothing else, increased testing. I think that the numbers that we have in our country right now of infected are grossly underestimated due to CDC's recommendation to hospitals on who was permitted to be tested previously. Now that the doors are opening up and permitting hospitals, or CDC providing the guidance for hospitals to test additional persons, we will see a significant spike in confirmed cases. But I also question what kind of impact on the numbers we're going to see just simply as a function of lack of prior testing. There's multiple types of coronaviruses out there, and I am not 100% certain on the testing protocols, but I believe there's an opportunity for us to identify homegrown cases that may not have necessarily emanated from the source of Wuhan. But the types of questions that I'm receiving from the industry pretty much related to healthcare, working in healthcare environments. A lot of folks that I work with have regular work in hospital settings, and with the hospital being a natural concentrating point for those confirmed infected, their employees are expressing significant concern about their personal risks. And so we've been fielding a lot of questions from companies large and small about crafting corporate communications on how to manage fear amongst their workforce.
One thing I heard that was really interesting that someone was, I can't remember where I'm seeing the volume of information I'm getting right now, but a lot of people are concerned about schools and hospitals, of course, but it seems that a lot of restorers are starting to hear from places like assisted living care facilities, senior housing, and based on just the fatalities that we're seeing now, it seems like that particular demographic is going to be particularly at risk. What are your thoughts on that?
Oh, absolutely. I mean, for what we know of this virus so far, that is really the at-risk group. For the most part, it hasn't had a dramatic impact on the very young, which is different from influenza, or the folks who are relatively healthy in the middle years of their life. It's all us old folks that are at risk, and folks who already have immune compromised conditions that make us more vulnerable. And it seems to be very, very rapidly serious with that demographic.
Norris, I just hope when I'm an old folk like you that I can have a mustache like that.
Yeah, I hear you.
So Norris, you JJ mentioned a few of the sort of calls he's getting, but you are getting. I mean, how many calls from restorers are you getting a day right now? Just a rough estimate.
Probably between 10 and 20, depending upon whether it's the weekend or the week.
Right, so they're just getting started. They're ramping up.
It is.
You were going to put them in like the most common questions. What are the most common questions that you're getting right now?
A lot of the common questions are, hey, what do we do? What's the protocol? What should we use? What PPE should we do? What product should we use? Those types of questions. And Mark, really, I want to step back here a little bit and just put a caveat on this conference. Do not substitute this for your own due diligence. All right. Follow what's going on with the CDC. They're doing at least bi-weekly updates. Follow what's being put out there by the authorities having jurisdiction, the EPA, the CDC, the World Health Organization, and be on top of what's going on there. One of the greatest challenges we all have is that telephone game and things getting blown out and misinformation being put out there. And we're completely dealing with that within the population at large. And I really want us as an industry not to do that. So I challenge all of you guys to diligently research the facts for yourself and go to key sources.
So speaking of key sources, I just pulled those up on the screen here. Hopefully everyone will be able to again see this and reference this. Some of the ones that you and I talked about that have a lot of information, because a lot of the information we're getting right now is changing pretty quickly.
Very rapidly.
So the rapid change of information means that key resources are really, really important. So some that we talked about were the NIH website. You can see up here in the address bar, that one is niaid.nih.gov. They have actually a specific sub-page for coronaviruses. They have the CDC page, which has a lot of information about this specific COVID-19 situation with summaries. WHO has on their site a sub-page with really live information and rolling updates on COVID-19. And then last, but certainly not least, I think probably a resource for restorers to be very, very helpful, particularly as they think about the sort of agents they deal with, which I know we're going to get into. We're going to talk about more in a little bit. Is from the EPA with a list of disinfectants that can be used that are registered. And I know when we get into that, so we're going to save that topic for just a little bit later, that will be really helpful. But I appreciate you mentioning that. I think on the RIA website, to the degree that we can, we'll try to post helpful links there as well to give some direction to restorers. So Norris, I'm going to ask you a really personal question because you are uniquely positioned to answer this question. Okay, so you're not a restorer today. You don't have a restoration company with a bunch of employees and air movers and equipment like the rest of us today, but you have. You've done that a long time. So if today, based on everything that you know, you have this very unique background that has positioned you uniquely to be able to evaluate this situation, how would you be looking at it if you owned a restoration company today? How would you be evaluating this issue that we face, and what would be your thinking as you look at the risk? How would you be evaluating risk? What would you be looking at, and how would your decision process look?
Yeah, and I really appreciate you asking that and approaching it this way, Mark, because as a restoration industry at large and in general, we tend to get a call and we're like, absolutely, we can do it, and then we're going to go figure it out. We're the folks on the white horse, and we don't know how to say no. And this is a case where we really need to step back and do some serious planning. Some of the things that you need to look at as a world, we're doing major planning and developing strategies to cope with this. You need to look at it globally within your country or within your company as well. First off, what are your employees' concerns? They've got fears and concerns just like all the rest of us. What are their concerns and what are their vulnerabilities? And when I talk about what are their vulnerabilities, do they have young children at home? Do they have elderly folks at home? Do they have immune compromised people within their house that what you might ask them to do could significantly put their family and their world at risk? The other thing that you need to look at is what's their safety net? We've got a lot of things already beginning to unfold across the country and across the world where we have companies who are shutting down. We're doing temporary layoffs. They're doing quarantines in areas. If your folks are affected by that, one of the other breadwinners in the house, or even them in your community directly, what's their safety net like? What are you going to do with that? How are you going to compensate, or are you going to compensate your employees if they close the schools and they lose childcare, and now they might be able to come to work, but there's no one else to take care of that support network that they normally have is gone. Those are some of the basic questions you got to start with. And then what's going to be their willingness to perform disinfection activities? And what's their training level? These are some real basic things that we've got to get with. And honestly, evaluate your technical capability as a company to respond. Right? And this is critical that you're honest with yourself and that you make an informed assessment. And if you're not sure what that informed assessment is, that you do your own due diligence to find out what that is. We've given you the resources. Spend the time and look at it. Do we have the appropriate PPE? Do we have the appropriate disinfectant products? Do we have the appropriate training? All right. Do we have the appropriate insurance? I want to talk to my insurance underwriters. What's my workman comp exposure? I want to talk to my work comp underwriters. I want to know where I stand there. Then I'm going to get someone like Ed Cross on the phone and say, hey, where am I from a contract standpoint? What do I need to do to make sure that I have it properly in my language? That's just the foundation before you could even begin, in my opinion, to make an intelligent choice about going out and responding to doing something that may be well within your wheelhouse, but is a little unique, or a lot unique in this case, with this new and unknown virus. The other thing that is really going to be important is that you craft your messaging as a company, all right? So that all of your employees know what the messaging is to their friends and family from where they work, because they know where they work, they're going to get asked questions, as well as folks who call in, and what your company's messaging is to the public. And it needs to be founded in realistic capabilities that you can do, all right? We all, I got a contractor already in Texas after the corona patient walked around the mall. I got a call, hey, can you come in and disinfect the entire mall before we open tomorrow morning? Well, you know, of course we can. No, we can't. And it's really important to make sure that your verbiage and language is correct. We actually, you cannot go out there and say, we disinfected that space, unless you're going to validate that you disinfected it. We clean and we apply disinfectant. We don't necessarily know it worked, all right? So there's a lot of nuances to the language. That's why I recommend you speak with someone like Ed to make sure you get that down correct. While I'm on a roll here, Mark, I want to just keep going with something else here. When we get into the cleaning solution part, the disinfectant part, for those of you who are Mid-South, you're going to get to hear some of this afterwards, because this was my regularly scheduled presentation. But as an industry, we don't do a good job of really understanding the products that we work with. And you really need to take a look at the EPA registrations on the products. Go to the EPA webpage, look up the lists that are there. Look at list N, look at list L for Ebola. Make sure that the product that you are using as the active ingredient is effective against an enveloped virus first. And then make sure that you understand what the application requirements are, that it needs X amount of exposure or dwell time, that you may not be able to dump your favorite solution of choice in the off-the-shelf static electricity sprayer machine that you've been sold at the last conference, because it is not registered for applying that way, all right? You need to understand the whole thing. You're not going to find all of that information without looking up the registration and going to the EPA website. So this is not a case to just do a knee-jerk reaction and be a hero and respond. You really need to invest the time in your company and your people to have a plan and be very clear about exactly what it is and how you're going to execute it.
So Norris, that's a lot of good information. Before I jump back to JJ, you talked about the issue of contracts and risk. So Ed, again, being mindful of the fact we don't have a tremendous amount of time. I'm sure you could teach several sessions on the contracts and the liability risk that a contractor faces in this. But I'm just going to speak personally. I mean, we've had a number of these calls, and my biggest concern is if someone hires us to go in to their business, let's just say the mall that Norris mentioned, with an expectation that we are going to make their building safe, and then someone contaminates that building 10 minutes after we're completed, and then someone gets sick, that they're going to come back and say, you didn't clean our building, right? I mean, the stakes here seem to be really unusually high in like Norris said, probably one of the biggest public health issues of maybe even our lifetime. So Ed, give us some very quick, very salient points on this. Again, we may schedule additional briefings for our members and for the industry, but go ahead and respond to the comments from Norris.
Yeah, sure. First, I want to thank Karen Clendenning for the excellent work she did with MSPCA to set up this event and this town hall here on short notice with us today. I want to echo what Norris talked about with regard to rushing into this. All right. And I know there's a great temptation out there for people to strike at this. All right. And it's really important to learn as much as you can about the subject matter and to get the proper training. All right. Haste makes waste. And so if you don't want to answer no to potential customers, answer not yet. All right. Worker safety is your #1 priority. Keep in mind that when a lawyer is suing a restoration contractor next year, restoration contractors will get sued next year for negligent COVID-19 disinfection projects. They're going to have the benefit of hindsight. The restoration contractor who jumps in now, who's being hasty, doesn't have that benefit and is at a serious disadvantage. Talk to your insurance broker, make sure that your coverages are in place for this. And it's now time to do some very, very serious risk management. There's different testing protocols that are out there, and the problem is very little is known about this subject at this point. And because of that, we don't really have standard practices for how to address this. So it's very difficult to define the standard of care. But again, people in hindsight will be defining it for you. So you need to show that you were methodical and that you were careful in the process that you implemented. So very, very important. You have to have, in my opinion, based on what I know today, you have to have an industrial hygienist involved. You got to have some sort of skilled, educated environmental consultant who's going to come up with a clear written protocol that's going to be agreed upon by your customer in writing before any work begins. Similar to a mold remediation project, you've got to figure out how you're going to judge the success of this. Is there going to be some sort of clearance testing? You have to have some measurable way of showing that you fulfilled your obligations under the contract. And naturally, as has been alluded here so far today, I'm really concerned about cross-contamination. So you could have a perfect project, you come in and you pass, and 5 seconds later, somebody with this virus comes in and contaminates it. You have to have some written proof, in my opinion, that you have achieved your goals before the building is cleared for reoccupancy. What we're doing here today, ladies and gentlemen, is just barely scratching the surface of all of this. As you can tell, all of this is evolving very rapidly. So it's really important for everybody to come to the RIA National Convention coming up in New Orleans. That's April 14 to April 16. Go on to restorationindustry.org to register for that. Among other things, I am going to be presenting there a session on how to draft, prepare, negotiate, and present a contract for COVID-19 disinfection services. We're going to be talking about indemnity issues. We're going to be talking about releases. We're going to talk about how this is similar in some ways to mold remediation, but is very different in some ways. It is similar in some ways to a crime scene cleanup, but as Jeff Jones pointed out the other day in his excellent interview with Michelle Blevins on R&R, which you can see online, this is different from a crime scene because on a crime scene, you don't have a known pathogen. You could be dealing with all different sources of viruses and fungi and bacteria. Here, in this particular case, the good news for everybody is you have a known pathogen. You know what you're after. So set up your guidelines and your protocols for how you're going to do the work. Document like you've never documented before, and then get some proof that you've completed your work, and I hope you get paid for it. And that's going to be another challenge.
Yeah, so an excellent point. We're going to talk a little bit at the end about some of the ways that we're going to address this very timely issue in New Orleans in April at the very end. So everyone should stay tuned for that. I did have a bunch of folks I was able to let into the room after we had started. I just want everyone who showed up a little bit late, I want you to know this is all being recorded. If you're concerned about what did I miss at the very beginning, you will have the opportunity to go back and watch this again. Now, JJ, I want to turn to you based on some of the comments that Ed just made. Ed talked about clearance testing and working with a certified industrial hygienist or other environmental consultant or professional. And I think probably from your standpoint, what you're seeing from an epidemiological standpoint is highly unusual. I don't know how the test, I mean, they're talking about not having the capacity to test people if they even have this disease right now in health care facilities. So how would you approach this from a clearance testing, or as Ed mentioned, a ultimate efficacy standpoint? What would you be looking for? How would you be testing for it? And what should restorers be speaking with as they interview or identify certified industrial hygienists who are even qualified to deal with something like this?
Sure. Thanks for the question, Mark. At minimum, I would recommend chemical indicators on surfaces that would validate application at a certain concentration on a given surface. I would seek to have a statistically valid number of those chemical indicators, but preferably I would go with biological indicators to then not only assess contact and coverage at sufficient concentration, but actually be able to demonstrate effective kill rates on those biological indicators. And I believe that is kind of getting to the heart of what Ed was mentioning, is having that confirmatory data that, you know, the products that you applied, there was sufficient coverage and that there was demonstrated kill rates based upon the utilization of biological indicators.
That's really helpful. So, and this is not, we always want to be careful that we're not endorsing any particular product. So I want to give that disclaimer up front, but I know in our company, we regularly use ATP testing to determine when we're working if what we're doing is effective before we call an industrial hygienist. Okay, is that going to be effective? Could a restorer use that throughout their process and have any sense of confidence that they're ready for that clearance test if that's going to be done? Is that appropriate for this situation, or is that a waste of time?
I think it could be misleading. I think that we could get a lot of false negatives or even false positives with ATP because we do have a target organism here that we're chasing with this novel coronavirus. There's, you know, in any living, anything, quote, living or formerly living on that surface could be detected by ATP. So if ATP, adenosine triphosphate sampling, is part of the post-application quality control, then it's imperative that physical removal of any contaminants on a surface was handled adequately prior to the application of disinfectants, such that if we've got remnant contaminants on a surface other than the novel coronavirus, then we could have a false positive. We may actually have achieved disinfection of the target, but then ATP may identify the presence of other formerly or still living elements on that given surface. So I don't think that ATP is really, I mean, it's a tool in the toolbox. It's an easy way to do a rapid assessment, but I think that biological indicators are going to be key in having the confirmatory information to defend, you know, the restoration industry to defend themselves against downstream allegation of incomplete disinfection.
Great, thank you. That's, I think, really helpful. Let me, I'm just going to go to Katie real quick. Katie, We now are at 11:35. I think do we have about 5 minutes left, or do we have a little bit of margin there? I'm going to follow your lead on our time.
We can take about 10 more minutes.
10 minutes. Okay. So we are going to have a hard stop at quarter till, wherever you're at. So we're going to keep going until we run out of time. And then I think certainly we will have follow-ups to this, because we're just barely scratching the surface. Norris, I'm going to start with you on this. PPE. This is the $64,000 question. If you are going to send someone, even just to evaluate these properties, what would be the minimum that you would have? How might this differ from other cleanups that we're sending our workers into? Give us some indicators as to what we need to be thinking about for PPE.
Well, Mark, from a legal standpoint, I'm hesitant to stand here and direct what PPE someone should use. CDC has published guidelines on recommended PPE going into these environments. Personally, I would not be comfortable going in with anything less than a powered air purifying respirator from a respiratory protection standpoint. I want that positive pressure that's there, especially because of this mustache. You know, I can't get a good seal on a negative pressure, but that would be one of the criteria that I would certainly step up there if it were, you know, the world according to Norris. Other PPE, we have to assume at this point that it could be airborne. And from what I've seen in the CDC readings that I've done, they are treating it as a potential airborne pathogen. And so we want to make sure that we're protecting ourselves that way as well. So looking at full 5X suits, probably double gloving, disinfection protocol for the PPE before it comes off. A substantial protocol. But again, I would not be comfortable standing here and saying, hey, do exactly this. Guys, we have guidelines presented by authorities out there with the training and education working with this pathogen already. Follow those.
So, and I think that's really important. I mean, it sounds to me that you would, in this case, you would be looking at maximum levels of protection rather than minimal. I mean, you can't go into a hardware store and find an N95 dust mask, but from what I'm gathering on what you're saying, responding with an N95 dust mask, we're hearing a lot about that in the media right now. I've never heard N95 in media as much as I have in the last week. But that might not be appropriate is what I'm picking up from you.
Exactly. And as we know in our industry, hopefully, everyone has an OSHA respiratory protection program. Everyone is doing fit testing, and fit testing is required for an N95. And even with appropriate fit testing, it's difficult to have consistent quality seal and fit with an N95 with people who have been trained to use a very specific model of an N95. So to just randomly grab one off the shelf and stick it on is really a false sense of security.
Excellent. All right, so let's talk about, Norris, I'm going to again put you back in the place of a restorer, okay? And I want you to speak practically to folks. We understand that you're not making recommendations, so this is an entirely hypothetical question that I have for you, okay? And my hypothetical question is this: if Norris Earhart had Earhart Restoration Services today, and you received a call where someone was trying to take proactive steps, there wasn't necessarily a known infection in a building, okay, but someone wanted to take proactive steps. They said, listen, we are concerned. We want to take proactive steps for our business. Can you come help us out? What would you do in that situation in your hypothetical restoration company? And again, for anyone listening, this is not a protocol. This is just trying to provide some practical guidance to the people who are listening in right now, because this is what we're dealing with. And we can't have paralysis by analysis necessarily because it's not practical. So what would you do, practically speaking, in that scenario in the hypothetical company?
Sure, and I think probably everyone who's tuned into this has already had that call. What's driving the call is fear and a lack of understanding. And the first goal and role that we have is to try and understand what that fear is, what's driving it, what is their concern, and then be able to educate and address that. If they have not had any exposure, they're trying to be proactive. Again, simple cleaning, regular daily cleaning processes are exactly what you would do. Increased hand washing, proper hand washing, full 20 seconds with proper scrubbing around the nails, 60% or greater alcohol-based hand sanitizers on a regular basis. Making sure that just the area in general is clean and maintained clean is a lot of it. And then explaining to them that, listen, even if we came out there and we did a deep clean of your property, as soon as we're done, if someone were to walk in and sneeze or be available, bring it in, it's going to be right there. It's not a residual prophylactic to the risk. It's a moment in time. So that a lot of times that type of education alone, just with that initial conversation, may put the people at ease and may be able to give you the opportunity to design a way to help them that makes sense, that they don't have unrealistic expectations for.
JJ, I'm going to pivot over to you because you're an industrial hygienist, a certified industrial hygienist. If I haven't mentioned that already, my apologies. But as a certified industrial hygienist, there's going to be people here on this call today who perhaps have no interest in responding to this. They look at the risk, they evaluate the risk, and they say, you know what, I don't want to go put my people in this place where we are being tasked with this response. But I know that I've got an issue as an employer to protect the people that work in my restoration company. I can tell you just anecdotally from my own company, in one of our branches, we had a large percentage of our staff get hit with the influenza B, and it was hugely disruptive to our operations. So we had to look at this real closely ourselves. So just from the standpoint of industrial hygiene, what would be the minimum recommendations that you would have for folks as good practices, in addition to what Norris already mentioned? He mentioned hand washing, 20 seconds, washing around the nails. But what else should restorers who maybe don't want to respond put in place to protect their workers?
So I think this is a tremendous opportunity for us to really focus on, public health hygiene in general, not to reiterate the hand washing and things like that, but that, that we take the opportunity to educate our workforce that to understand that you can wash your hands all you want, but then what surfaces are you subsequently touching that may be contaminated? An understanding of the method of distribution, an understanding of the range of purported viability on a surface for this virus to effectively enter a new host. So really focusing on, what the employees do at home and how and doing those protocols within the office, but then encouraging the workers to carry those strategies back home. And I think it's really an opportunity for some really significant increases in our own personal execution of public health.
And I think one of the other things we just had to talk about yesterday is the fact that it's an opportunity to encourage people just in general healthy living habits amongst our staffs. This is probably a good time to boost your immune system by making sure you're getting adequate rest, good nutrition, and, probably not a good time to be drinking a lot of alcohol. Just the basic things of making sure your immune system is strong is probably helpful to all of us from a worker standpoint.
One more thing I want to mention, Mark, a strategy that I think could be immediately deployed is the utilization of luminescent sprays and markers that within your office, you can apply certain sprays or wipes that are invisible to the naked eye, but then underneath illumination by UV light, those sprays that you apply as just sample, just targets, then you could illuminate the hands or the face or the surfaces that are quote contaminated by this surrogate spray or wipe that you put on doorknobs, handrails, computer keyboards, as a means of validating proper hand hygiene and surface disinfection just in the normal operations of the office. Is just something there that this is an opportunity to really have an awakening, an aha moment with the employees of the effectiveness or lack thereof of their current personal hygiene habits.
Interesting. Very helpful. Where would folks go to get more information about that, JJ?
I'm going to defer to Norris with that one. Norris, without trying to mention a specific product is what I'm trying not to do here.
Yeah.
What would be a vendor they might reach out to? What sort of vendors?
If you Google that, you can probably find it. Most of your healthcare environmental services teams will use a product like that.
Just mention a couple of products so that we don't have to feel like we're.
Yeah, I mean, I tell you, the one that I utilize in my training a lot is a lotion, and it's made by a company called Glow Germ. But there's other ones, and there's other ways to do it. And essentially, like JJ was talking about, I don't know if you guys, this is probably my age showing through, but when you were a kid, you chewed up the little red tablets, and then you had to brush your teeth and make sure you got all the red gone. It's the same kind of thing. I typically have them put it on their hands before lunch, and then after lunch, I'll look at their hands with the UV light, and they'll recognize really how filthy their hands were that they just ate with.
Interesting. Great points, JJ. Folks, we are out of time. Katie and the Mid-South folks, thank you for facilitating and allow us to use this venue to get this message out. Of course, this will be posted to the RIA Facebook page. Feel free to share with groups that you think would benefit from this information. Likely we will we hardly scratched the surface of the questions I had today. For example, I know restorers love buying toys more than anything else, and everyone's asking, what new toys do I need for this? We never even got to that question. So likely we will schedule a follow-up, as Ed mentioned. April 14th to 16th, our RIA International Convention in New Orleans. We have been modifying the content of our event specifically to deal with coronavirus and COVID-19 issues. So if you want more information, we are modifying the schedule to accommodate some very, very important topics that relate directly to that. We hope to see you there. Thank you for being here today, and stay posted for more information about how this may impact your business. For the panel folks, Norris, JJ, Katie, Ed, thank you so much for being here and offering this. Folks, stay posted, and let's keep the discussion going.
Take care.
Thank you.
Thank you all.
Infected no more, hashtag.